Bismillahirrahmanirrahim. Assalamu alaikum. Now, as we are doing the heart physiology, so after completion of all the physiology portion, we have started with that of the pathologies. So the murmurs related to the heart, they are very much important. So we are going to learn about them today, and um, we are going to learn what kinds of different sounds which we can hear with that murmurs. They usually indicate the turbulence, and they range from 1 to 5 in loudness. Now, what are those criteria like 1 to 5? One is that, does it occur during diastole or systole? Whether it is crescendo, that is getting progressively louder and louder, and does it decrescendo, like it gets progressively less noisy or a bit quieter, and where do you hear it best? Location of the murmur, the best you can hear, like either it is there in the neck or chest or in the axilla. Now, different other sounds, they are like gallops, rubs, clicks, knocks, continuous murmur. Now, what is gallop? Either these are S3 or S4 sounds. Rubs, they are the pericardial or plural friction rubs, and usually indicated either that there is infection of the pericardium, that is the pericarditis, or possibly the pleurisy. And it is very careful to listen for both the heart and lung sounds. Then the rubs, they sound like sandpapery. Clicks, they occur in systole and represent the loud valve closure. Then diastolic knock, it occurs because of an abrupt arrest of ventricular filling by a non-compliant and constricting pericardium. Continuous murmur, indicating a constant shunt flow throughout the systole and diastole, and that is the conditions like coarctation of aorta or patent ductus arteriosus. Now, how we are going to describe a heart murmur? The timing. Murmurs, they are longer than the heart sounds. The heart sounds can be distinguished by simultaneous palpation of the carotid arterial pulse. Either they are systolic or diastolic or continuous. The shape, they are crescendo, that is, they either grow louder or they go quieter, or crescendo, decrescendo, or have plateau. Location of maximum intensity is determined by the site where the murmur originates. Radiation, it reflects the intensity of the murmur and the direction of blood flow. Intensity, it is graded on a 6-point scale, that is, either very faint, quiet but is heard immediately, moderately loud, heard with stethoscope partly off the chest, and grade 6 is having the greatest intensity and is heard even if there is no stethoscope used. And thrills, they are associated with murmurs of grades 4 to 6. Pitch. Pitch of a heart murmur, it is high, medium or low. The quality, it is blowing type, it is harsh, rumbling, musical. The others, that is, either there is presence of any variation with respiration. If there are right-sided murmurs, they change more than that of the left-sided murmurs. Variation with the position of the patient, variation with the special maneuvers. Valsalva, standing, Murmurs, they decrease in length and intensity except hypertrophic cardiomyopathy and mitral valve prolapse. Production of murmurs, incomplete incompetence of heart valves, increased velocity of blood flow, for example, in severe anemia and in hyperthyroidism. Patent ductus arteriosus. After birth, normally it closes, but in a few cases it remains patent, causes murmurs throughout systole and diastole. A valve in which the leaflets adhere to one another so extensively that blood cannot flow through it normally is said to be stenosed. So it is very important to know that a valve in which the leaflets adhere to one another so extensively that blood cannot flow through it normally is said to be stenosed. Now let's talk about the systolic murmurs. They are derived from increased turbulence associated with increased flow across normal semilunar valve or into a dilated great vessel. Flow across an abnormal semilunar valve or narrowed ventricular outflow tract, for example, aortic stenosis. Flow across an incompetent AV valve, for example, mitral regurgitation. Flow across the interventricular septum. Now we have the diastolic murmurs. Almost always indicates heart disease. It is of two basic types, that is early decrescendo diastolic murmurs. Early decrescendo diastolic murmurs signify regurgitant flow through an incompetent semilunar valve, for example, aortic regurgitation. Then we have the rumbling diastolic murmurs in mid or late diastole, suggesting the stenosis of an atrioventricular valve, for example, mitral stenosis. Now outline is this, that when does the murmur is occurring, systole or diastole, where it is loudest. Systolic murmurs, they are like in aortic stenosis, ejection type, mitral regurgitation, hollow systolic type, mitral valve prolapse, late systole type. Then diastolic murmurs, they are seen in conditions like aortic regurgitation in early diastole, mitral stenosis, mid to late diastole. Summary. Now look at this. This is very important diagram, and it is going to make this thing very easy for all of you. This slide is very important. So if you learn it, then you will know in which condition you are going to see which type of murmur. Like pre-systolic A, it is seen in the mitral or tricuspid stenosis. Then the mitral tricuspid regurgitation, you're going to see this. Then in the C, you can see aortic ejection murmur. Then D, you can see the pulmonic stenosis, the spilling is seen in the S2. Then aortic or pulmonary diastolic murmur in E. Then you can see the mitral stenosis with opening snap in F. Then in G, you are going to see for the mid-diastolic inflow murmur. Then the continuous murmur or of patent ductus arteriosus. So this diagram is going to make you learn about how you're going to see for the systolic and diastolic murmurs and what is the continuous murmur. Then the heart murmurs, which are being caused by the valvular lesions. There is presence of systolic murmur of aortic stenosis, diastolic murmur of aortic regurgitation, systolic murmur of mitral regurgitation, diastolic murmur of mitral stenosis. The murmurs of aortic stenosis and mitral regurgitation occur only during systole, whereas the murmurs of aortic regurgitation and mitral stenosis occur only during diastole. So these two things, they are very important for you all to learn, that these two murmurs, these two systolic and two diastolic type of murmurs related with that of aortic and mitral valves, they are very important for all of you to learn. Now the heart murmurs caused by the valvular lesions, the murmurs of aortic stenosis. In aortic stenosis, what happens is that there is narrowing of aorta. So what happens, that it leads to increased resistance to ejection of blood. As a result, there is severe turbulence of blood at the root of aorta. There is intense vibration, the loud systemic murmur after first heart sound. In aortic regurgitation, the aortic valve does not close, which is essential during diastole. Therefore, in aortic regurgitation, the blood backflow in the ventricles, causing diastolic murmurs after the second heart sound. Then murmurs of mitral stenosis. Now, in mitral stenosis, there is narrowing of mitral valve, leading to increased resistance of blood flow to ventricles. And after 1/3 of diastole, when enough blood fills the ventricle, it causes vibration which present as a diastolic murmur. The murmur is often not heard but could be felt as thrill at the apex of the heart. Murmurs of mitral regurgitation. In mitral regurgitation, the mitral valves are unable to close, which is essential during systole. Therefore, the blood flows back to atrium and is causing a systolic murmur. Then we should be learning about the machinery murmur or continuous murmur of patent ductus arteriosus. In patent ductus arteriosus, the blood flows from aorta to pulmonary artery, and the murmur is during systole and diastole. The murmurs during systole is much more tense than in diastole because the pressure in aorta is higher during systole than in the diastole. Again, the phonocardiogram from normal and abnormal hearts. See the first, second, third heart sounds and how there is presence of the murmurs in systole and diastole in different conditions. See, in aortic stenosis there is systolic murmur, in mitral regurgitation systolic murmur, in aortic regurgitation mitral stenosis diastolic murmurs, and in patent ductus arteriosus you need to see the continuous murmurs. Systolic murmur of aortic stenosis. There is intense vibration with a loud murmur during systole, and it is due to severe turbulence of blood in the root of aorta, which is transmitted throughout superior thoracic aorta, even into the large arteries of the neck. It's a loud sound, it's a harsh sound. In severe stenosis, it may be so loud that it can be heard even several feet away from the patient, and the sound vibrations can often be felt with even hand on the upper part of chest and lower neck, a phenomenon known as a thrill. So you're all supposed to learn that thrill is actually a sound which can be felt by just placing your hand on the surface of that particular part. It is actually a sort of palpable sound. In aortic stenosis, the blood is ejected from the left ventricle through only a small fibrous opening of the aortic valve. The resistance to ejection, the blood pressure in the left ventricle, is as high as 300 millimeters of mercury. While the pressure in the aorta is still normal, a nozzle effect is created during systole, with blood jetting at tremendous velocity through the small opening of the valve. Severe turbulence of the blood in the root of aorta. The turbulent blood impinging against the aortic walls, leading to systolic murmur of aortic stenosis. Diastolic murmur of aortic regurgitation. It is actually a blowing murmur, a relatively high pitch with a swishing quality. It is heard maximally over the left ventricle. In aortic regurgitation, there is no abnormal sound in heart. There is no abnormal sound heard during systole, but during diastole, the turbulence of blood jetting backward from the high pressure aorta into the blood already in low pressure left ventricle causes this murmur. Now let's talk about the systolic murmur of mitral regurgitation. It is a high frequency blowing, swishing sound similar to that of aortic regurgitation, but it is occurring during systole rather than the diastole. It is transmitted most strongly into the left atrium, but the sound of mitral regurgitation is transmitted to the chest wall mainly through the left ventricle to the apex of the heart. The left atrium is so deep within the chest that it is difficult to hear this sound directly over the atrium. In mitral regurgitation, the blood flows backward through the mitral valve into the left atrium during systole. Diastolic murmur of mitral stenosis. It is usually weak and is of very low frequency. Most of the sound spectrum is below the low frequency end of human hearing. Even in severe mitral stenosis, no murmur may be heard during the first third of diastole. It is produced due to difficulty in passage of blood through stenotic mitral valves from left atrium to left ventricle. Now let's talk about the congenital anomalies of the heart. There are three major types of anomalies which are seen congenitally related to heart. They are like stenosis or patent ductus arteriosus, that is the left to right, and tetralogy of Farlow or Farlows Tetralogy, that is the right to left shunt. Now stenosis. Stenosis of the channel of blood flow at some point in the heart or in a closely allied major blood vessel. They are seen in form of coarctation of aorta. If there is congenital aortic stenosis or there is congenital pulmonary stenosis. Patent ductus arteriosus, that is the left to right. It is an anomaly that allows blood to flow backward from left side of the heart or aorta to the right side of heart or pulmonary artery, thus failing to flow through the systemic circulation. Machinery murmur. See, the patent ductus arteriosus is showing the intensity of pink color that dark venous blood changes into oxygenated blood at different points in the circulation. And at the same time, the diagram is showing the backflow of blood from the aorta into pulmonary artery and then through the lungs for a second time. Then another very important anomaly, that is the Farlows Tetralogy, that is the right to left shunt. It is an anomaly that allows blood to flow directly from right side of the heart into the left side of the heart, thus failing to flow through the lungs. And this is the most common cause of blue babies. In this condition, there is presence of four abnormalities of the heart together. So remember, if there is presence of four abnormalities simultaneously in the heart, the condition is given the name the Farlows Tetralogy. And what are those conditions? The aorta is originating from the right ventricle rather than the left, thus bypassing the lungs. The pulmonary artery is stenosed. Blood from left ventricle flows either through a ventricular septal hole defect into the right ventricle and then into the aorta, or directly into the aorta that overrides this hole. Because the right side of the heart must pump large quantities of blood against the high pressure of aorta, its musculature is highly developed, causing an enlarged right ventricle. See that the blood is shunted from right ventricle into the aorta without passing through the lungs. So the diagnosis is usually based on the fact that the baby's skin is blue. That is, the baby is having cyanosis, having high systolic pressure in the right ventricle, an enlarged right ventricle, and abnormal blood flow. Surgical treatment, that is treated successfully by surgery. The usual operation is to open the pulmonary stenosis and is closing the septal defect, reconstruct the flow pathway into the aorta. When surgery is successful, the average life expectancy increases from only 3 to 4 years to 50 or more years. So it is very important to do the surgery at the right time, to open the pulmonary stenosis and to close the septal defect and to reconstruct the flow pathway into the aorta. So this is very important. The use of extracorporeal circulation during cardiac surgery. The system in which artificial heart-lung machines takes the place of the heart and lungs during the course of operation is called the extracorporeal circulation. It is frequently asked that what is it? So this is all about today's lecture. Thank you very much all of you. Stay blessed and Allah Hafiz.